Hi, my name is Siddharth Bhatia, student ID 100600344. Today I am here to perform a wound dressing on James Brown. He's a 20 years old man who had a left femur fractured and had a stab. So his sutures have been removed from the wound yesterday. Today it would be just a normal wound dressing after examining the wound and using the aseptic non-touch technique. So I'll just go ahead and proceed with the procedure. Knock. Hi James, how are you today? Good, thanks. My name is Sid, one of the nurses looking after you today. As you know, you had the wound sutures taken off yesterday from the wound. I'd be just changing a dressing after examining the wound, like looking at the wound condition. Is it okay with you for me to do the wound dressing on you today? Yes, that's good. Before we proceed, I just wanted to ask you if you wanted to go for toilet or if you have any pain, you want to have some pain medication for it before I start. No, you don't need anything. That's good because it's going to take 5 minutes, 5 to 10 minutes roughly. So I'll just proceed if you don't have any concerns to raise. That's good, man. That's good. I'll just start soon, yeah? I'll just grab my equipments ready. I'll just get all my equipments ready and I'll just start with the procedure. Alright, so I got my equipments here. I'll just do my hand sanitizer, like hand rub. I'll just take the wound dressing off which was applied yesterday after taking the sutures off, and then after examining the wound I'll just start putting the new dressing on. As you can see, there is no exudate, no sign of infection, no pus can be seen, no swelling. So it looks like wound is healing well. We can just proceed further to apply the new wound dressing off. So I'll just grab the dressing pack out. With the dressing pack I'll be checking all the expiry dates and whatever the contents are in there. Due to be expired November 2024, and it's got sterile, woven sterile filled, bluey, graded dressing tray, dressing towel, woven swabs, disposable plastics, forceps, 1 yellow and 2 blue. I'll just proceed further. As we know, the surroundings of the sterile feed up to 2.5 meters is not considered as sterile, so I can touch it. I'll keep on putting up the stuff I would need for the wound dressing. So that's my sterile field ready. I'll just put in the rest of the stuff. So this is a dressing pack. This is a dressing I'm going to put in today, which is melalin. And it's not punctured or anything, and it's expiring on November 2024 again, so I'm happy to proceed with this dressing. As it's a non-touch technique, so I'm not supposed to touch any of the equipments or any of the stuff inside the sterile field, otherwise it would be contaminated. And I need the scissors as well, as I may have to cut the wound dressing according to the size of the wound. Extra gauze is always helpful while doing the wound dressing, so I'll just help with extra gauze as well. So as 2.5 meter is not considered red sterile, I can touch that area and then grab the stuff out. This is the normal saline I'm going to use to clean the wound, as there is nothing else prescribed by the clinician. So the expiry date on the normal saline is October 2021, so it's alright to use this normal saline. Bearing in mind not touching the sterile field, as it would contaminate it otherwise. Put in the normal saline. As neither of the equipment has been taken out of the sterile field, so everything is considered to be sterile until now. So I will just start with one of the gauge to clean the wound. As recommended, it's always from clean to the dirty, so that there is no contamination or no dust particles entering in the clean region of the wound. So it's usually recommended to clean it from middle to the outside. So as I have taken this forceps out of the sterile field, I would not be taking it back to the sterile field. And I'm gonna continue doing the same. I'll clean the region again with another forceps. As the wound is clean enough, I'll just use the dry gauge to dry the wound so that there is no moisture left inside the wound. As this is the dirty forceps now, I'll discard it. I'll pick up another forceps with my forceps which stayed in the sterile field so that I'm not contaminating anything. I'll just grab the forceps to dry the wound. As we cannot take the gauze back once it's been cleaned the wound. Now it's ready, the wound is ready for me to put the dressing on. All I gotta do is pick up the dressing, and with the help of another forceps I'll put in the dressing and apply opposite or a tape or whatever is recommended. Now my wound dressing has been done, and all I gotta do is take back all my stuff and discard it in the infectious waste bin, and I'll take I'll document it in the wound chart, as well as the type of dressing which has been applied in the wound chart and how often it needs to be rechecked again or redressed again. Thank you.